AM 1450, FM 99.3 KNSI. Welcome to another edition of Your Health. Your Health is produced in association with Centracare. And today we're going to be talking about integrative therapy. What is that? What are integrative therapies? How are they used to ease common side effects? What is aromatherapy? What's healing touch? What role do they play in a patient's recovery? And what about acupuncture and acupressure? How are they used? Well, the pressure's on. Kathi Sowada is our guest. Good morning. Good to have you.
Good morning. Thanks for having me.
Let's talk a little bit about Kathi Sowada and integrative therapy. How did you get involved with Centracare? Where did your education come from and all that stuff?
All right. Well, I currently work for Centracare, St. Cloud Hospital, as the integrative health specialist. Originally, though, I worked for St. Cloud Hospital as a nurse. Been a nurse for going on 25 years now. Along the way, I began to feel like all I was doing was handing out pills. And personally, I've always been a more holistic type person in my own health. So I thought there must be another way I could help people get healthy more naturally. So I did my research. Being a nurse, that's always part of what we do.
You bet.
So I did research, and I came across traditional Chinese medicine and immediately knew that's what I wanted to do.
Because typically speaking, our doctors they practice what it would be called, quote unquote, Western medicine, correct?
Correct, or also called allopathic medicine.
All right. But it is interesting to me that, here you are trained in that Western medicine, but wait a minute, maybe there's something else out there.
Right. I looked at traditional Chinese medicine because it is a whole system of medicine.
Sure.
So it combines many different modalities and ways of affecting the body.
The first time that I ever heard anything about integrative type of therapy, I was visiting a chiropractor, and they explained to me, look at your body like a huge electrical system, right? And everything goes up and down the spine, and then all of these little wires go to the very tips of your fingers, the tips of your toes, the top of your head. Is that about right?
That's one way to look at it.
Okay.
One way to look at it that I was more drawn to was looking at your body like a garden. And how we need different things in our garden to make it flourish. We need rain, but if we get too much rain, we're going to have trouble. We need sun, but if we have too much sun, we're going to have trouble. We need nourishment in the soil.
Yeah.
We need a little bit of wind. We need a little
that.
Yeah, right. So there are all these different aspects that have a correlation to our systems in the body.
I like the way you look at it better. That makes perfect sense, doesn't it? So when it comes to integrative therapy and therapeutic treatments, what does that do? I mentioned side effects earlier, right? Side effects from some medicines, side effects from working out. How does integrative therapy start to play a part in all of this?
Well, specifically looking at the cancer center where I work, all our patients who are going through their chemotherapy or radiation are offered an integrative health consult where they can come in and meet with myself or our other specialists, and we look at their individual needs, what's going on with them. Most likely they're having symptoms from their treatments, and we determine what's going on in their body, what their needs are, and develop an individualized plan from there.
Does that happen at all before these cancer treatments would begin? In other words, are you being proactive instead of reactive a little bit?
In my specific role, I typically just meet with people after their chemo. But definitely in the bigger picture of life, using these things ahead of time would help keep people stronger
Are
time.
there some side effects, if you will, that are common to every person that has this type of treatment, that type of treatment, and yet still a third type?
The most common side effects that we see people needing help with are maybe the nausea and vomiting.
Okay.
That's one of the typical things people think of when you're getting chemo. But it also affects your appetite. It affects how food tastes.
Right.
So you're not able to eat because food just doesn't taste right.
Right.
So things like that. Also the peripheral neuropathy, which is damage to the small nerves in the hands and feet that causes the numbness and tingling or burning pain or cold sensitivity, things like that. That can get pretty severe and affect people's ability to walk, balance. It can affect how you're able to use your hands, like buttoning clothes can become difficult.
Oh, sure.
So simple little things that you do day to day that affect your quality of life can really be impacted. And then the third thing that is the most common would be fatigue.
Okay. Now, are all of these symptoms, again, byproducts, if you will, are all people affected the same way, or are we all different?
We're all different. Going back to the garden analogy, everybody's garden is different, and everybody's garden needs different things. So that's why we really look at each person individually and come up with a plan that would fit their body and their needs.
Interesting. And it is something that is so necessary, I'm sure, as you're finding out, right?
Yes.
Kathi Sowada is our guest. She is an integrative health specialist with Centracare. And again, folks, we will be talking more about just exactly what integrative therapies are, how they are used to ease some common side effects, particularly when it comes to cancer treatment. What is aromatherapy? Does it really, really work? What are some of the best things that we can do there? And acupuncture, acupressure, how are they used when it comes to integrative therapy? A quick break. We'll be back in moments. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. You are listening to Your Health, produced in cooperation and conjunction with Centracare. Kathi Sowada is an integrative health specialist at Centracare, and she is here today to talk about integrative therapies. Let's backtrack just a little bit again, Kathi, and talk about exactly what integrative therapies are and how they are used at Centracare.
Sure. Well, integrative therapies are therapeutic treatments that are non-pharmacological, meaning they don't involve medicine, and they support the body's own natural ability to heal. So we're really supporting the whole person, body, mind, spirit, to get back into a place that they feel whole and well.
Does this work for men, women, children, everybody, all ages?
Yes. There are integrative therapies that are appropriate for everyone.
Well, the big question is, how do you make it work? How do you combine Western with Eastern types of medicine?
We always look at the person as a whole. So we do consider their Western medical diagnosis, what kind of cancer they've had, what medical treatments they're having for that cancer, because there are certain therapies that would not be compatible with a person's chemotherapy, for example. So we need to know what's going on, what medications they're on, that sort of thing. And then we look at what their needs are and determine what might be the best therapy for them.
When you sit down and you're having, is it all a question and answer kind of thing? There must be some observations that you have also.
Yes. When the person comes in for their initial consult, of course, there's a lot of back and forth talking, questioning, that sort of thing. But as acupuncturists and other integrative specialists, we do look at what the person looks like, their color, how they walk into the room is even a good indicator of what might be going on with them.
Well, what kinds of questions would you ask someone when they, like if I just walked in and sat down, boom, right here, right now, what would you ask Bob?
I would say, Bob, how can I help you today?
All right, so I would tell you, well, I'm going through cancer treatment. I have nausea. I ache all over. I'm not sleeping like I should. Where do we go from here?
I would go and have you go into more detail about each of those things and tell me more specifically about each of those areas. An acupuncture diagnosis is very particular on how a different symptom manifests. So several people may have the same symptom of, say, headache, but all headaches are different. So depending on how that headache manifests for you, we would have a different treatment. Sure,
there are different triggers of different symptoms, correct?
Yes.
And again, everybody's different.
Yes.
Wow. No 2 days are the same, I would imagine, for you.
Right.
Pretty interesting, no doubt. Okay, so when we come in and we sit down and you're asking these questions and you notice Bob's not got his head up. He's feeling not so good about something. Is it cancer? Is it something else going on with the family? Worried about insurance? Worried about paying for these bills? Do you notice those things?
Absolutely. And I always talk to people about those other things, not just physically what's going on. Because health is not just physical. We have emotional health, social health, what brings you meaning in life. I like to ask people, what do you do for fun? What brings you joy? Those are all important parts of our health.
When you do these, when you are in this question and answer kind of thing, do you find that the last thing people want to do is sit down and answer some more questions?
I don't run into that quite so much.
Good.
Because it's more of a conversation rather than here's a checklist, fill it out. So I really don't run into that too much.
At what point of the conversation, I'm just trying to imagine this happening, and I would have to think that it does. There's got to be a time in the conversation when the spark comes back in that patient, right? When they're sitting there, well, wait a minute. Maybe there is an opportunity for me to feel better about what's going on. And is it like about halfway through or 2/3 of the way through, and they maybe Bob would be sitting up a little bit straighter and may actually get a smile on his face?
Right. It really depends on the person. Some people come in already knowing about integrative therapies and acupuncture, and they know that's what I want to do because I know that's going to help me. Other people, it's their first time, and they really haven't had any exposure. They have a lot of questions about these things and how it works. So it really depends.
So with all of these questions that they may have about whatever type of therapy, is there reading material that you send home, videos, or how long does the visit usually last? If they want more information, can they sit there and learn more?
Absolutely. Our initial consultation is 45 minutes, so we have plenty of time to answer questions and talk things over, get more information about the person. I do send home simple information sheets with people, nothing that's too in-depth, because they are inundated with a lot of new things when they come in.
Kidding.
And one more thing to add to their pile of reading material is not always good.
So you have mentioned acupuncture a couple of times, right? Is this one of your favorite methods of treatment?
That is my specialty. Okay. I'm actually a doctor of acupuncture and Chinese medicine, in addition to being a registered nurse.
Okay.
So that is what I use most often. And it is a therapy that is good for so many different things that if people are willing to try it, that is usually what I will suggest.
Do you ever have battles within yourself because you are trained in both disciplines, I guess, Eastern and Western?
I wouldn't say battles, but it is a different way of switching your mind to look at things in different ways. But I think I've found a good balance of incorporating the two together and really implementing using the research to back up what I'm doing, looking at the research that's been done. What are the new studies that are out there showing that different things work? So I use that a lot.
Any idea how long acupuncture has been around?
We think it's been around at least 2,500 years. One of the main first textbooks of acupuncture is over 2,000 years old. So we think in order to get to that point where you could write a textbook, you had to have had hundreds of years of practice to find out what works, what doesn't work, that sort of thing. And they've also found mummies that have had tattoos on acupoints.
No kidding.
So that also may indicate that it's even older than that.
Who knows, huh? Yeah. Wow, that's really interesting, isn't it?
Mm-hmm.
Wow, very cool. By the way, we are talking with Kathi Sowada. Kathi is an integrative health specialist at Centracare. Specifically, you work at the Coburn Healing Center?
Correct.
Okay. And for those who may be a little bit unfamiliar with the Coburn Healing Center versus the Coburn's Cancer Center, can you kind of paint that picture for us?
Sure. The Healing Center was built about a year ago. We opened last year in August, and it's a separate building that's really there to support people through their cancer journey. We wanted to be a separate place from where they go in and get their cancer treatment because there's a lot of negative emotion attached to that.
Right.
We want it to be a place where you can walk in and feel that this is really a place for healing.
Were you just chomping at the bit waiting for this thing to open and you could get in there?
Absolutely.
Wow, that's cool. That is cool. We're going to take a quick break. We'll come back and we will talk about different types of therapies, including some of the integrative therapies that we have already mentioned. For example, acupuncture, acupressure. What's the difference there? What about aromatherapy? What is healing touch? We'll be back in moments. AM 1450, FM 99.3, KNSI. You are listening to Your Health. AM 1450, FM 99.3 KNSI. Welcome back to Your Health. Kathi Sowada is our guest. Kathi works with Centracare. She is an integrative health specialist. Acupuncture. You are a trained doctor of acupuncture, right?
Correct.
Okay. How are you going to, can you explain the difference rather between acupuncture and acupressure?
Sure. And I get that question a lot. Acupuncture uses very fine, solid, also called filiform needles, placed in specific areas of the body that have a known reaction that we're looking for. Acupressure stimulates those same areas of the body, but instead of using needles, we use a finger, a knuckle, a tool to press on that area instead.
So I've heard that if I have a headache, I should kind of massage the webbing between my thumb and my forefinger.
That is one area that is very effective for headaches.
But that would be acupressure.
Correct.
Correct?
Correct.
The other one would be you take that teeny tiny itty bitty needle. They're really not so teeny tiny itty bitty. They look big on TV, and you just pop that in there, right?
Well, they have to look big on TV or you wouldn't be able to see them.
Oh, okay. So they're not that atrociously big.
Correct.
Okay, good. Is that one of the biggest things that people have to get over? You're going to put that needle in me?
You know, I really find that most people have been through so much already that they're like, what's one more needle?
Yeah.
And then they actually see the acupuncture needles and feel what it's like, and they're, didn't feel that at all.
What does it feel like? Nothing? Do you not notice anything?
It depends on the person.
Yeah.
It is normal to feel maybe a little pinch or a mosquito bite kind
Just
of feeling
a little stick.
as we go through the
I've
layer
heard
of
that
skin.
before.
Yeah, a little stick. But once the needle is in, there's no pain. But it's normal to feel different things as your body reacts. For example, maybe a muscle tightening up or a tingling sensation or a warmth or maybe a dull, achy feeling. Those are all normal reactions of the body.
And obviously people are asking you these questions while it's happening, right? Because you're not put under or anything like that.
No. There's no anesthesia.
See?
There's no medication on the needles.
One less thing about side effects that you have to worry about, right?
Right, exactly.
Very good. What about aromatherapies? How do these things work? And give us some for instances. What works? What odor would work well, or what aroma rather would work well?
Sure. Well, for people who don't know what aromatherapy is, it's the therapeutic use of plant essential oils. So plants naturally make chemicals that have different functions for themselves. So they repel pests or they attract pollinators. It's kind of their own immune system.
Right.
So we can extract these oils and then use it for the therapeutic purpose for ourselves.
Okay.
So we have 4 simple ones that we use at the Healing Center: lavender, ginger, orange, and spearmint. And each one has several different therapeutic effects. So, for example, lavender is probably the one that most people have heard of. It's a very popular one. That one's used a lot to help with sleep, help you relax, kind of just a calming, relaxing scent. For someone else who maybe has a lot of fatigue and doesn't want to be even more tired, we would use something that's more stimulating, like the spearmint or the orange.
Okay. I'm thinking this may sound like an interesting career for someone, right? Mm-hmm. What kind of time are we talking about here? I mean, I know nursing school is years, right? But what about when you get into some of the Eastern styles of medicine, some of the integrative stuff?
Well, it really depends on what part of it you wanted to get into. So as a nurse, you could take continuing education and be certified in holistic nursing, which I have a certification in. And then you could practice things like the aromatherapy or healing touch or maybe even acupressure. To be an acupuncturist, however, there is much more education involved. There is at least a master's degree in acupuncture, and then you would need to pass national board exams. And then acupuncturists in Minnesota are licensed through the Board of Medical Practice. So the same board that licensed the physicians licenses the acupuncturist.
Gotcha. Let's back way away and not think about cancer treatment or integrative therapy for that. What if I am at home and I have a nasty, stressful day? What are some things that I can do? I always like to give people a little brief takeaway, right?
Oh, sure.
What are some of the things that I can do at my home in the evening to relax? I would think aromatherapy would be huge.
Aromatherapy can be very good, but if you don't have essential oils at home or you don't know where to find them, just simple deep breathing exercises can stimulate that relaxation response in the nervous system.
So in through the nose, hold that, count to 10, and then a concentrated blowing it out through the mouth.
Yes, you can do that. One technique that I like to teach to people is called box breathing.
Okay.
So thinking like a square, you're going to breathe in for a set amount and hold it for that same amount, then breathe out the same amount and hold it again. So you have that box if you're picturing it in your mind. So breathing in, hold out, and hold.
Excellent. I would think with that, after you've breathed out, people may be, I'm kind of running out of breath here, right? But after a while, you get used to all of that, and the training really starts kicking in. Okay.
And then that triggers you to take a deeper breath in the next time, too.
Very good. Now, if some folks would like to get more information about, something, an alternative, right? An alternative to the medicines that we have become so used to. I love it when you said, I don't like pills, right? They're a necessary evil sometimes, but some of those side effects may be more prohibitive, if I understand things correctly.
Right. And that's where integrative care comes in. We're integrating the holistic therapies along with the Western medical treatment to use them together in a coordinated way. So it's not using it instead of, but using it together to make everything work.
In concert with.
Yep.
There we go. Kathi Sowada is an integrative health specialist at Centracare. Kathi, just a phone number off the top of your head in case some folks would like to look you up?
Sure. They could contact the Coburn Healing Center at 320-229-5100.
Thank you so much for spending time with us today.
Thank you for having me.
You have been listening to Your Health, AM 1450, FM 99.3, KNSI.